So, Rafa, what's the topic that we're going to talk about today?
So today I would like to speak about how we are going to face a work with a patient from the first minute that we find the patient, and how we are going to use, which kind of approach we are going to use, and why we choose one approach or we can choose another approach. Let's say, for example, I have done coaching for a long time and NLP, and I'm doing IEMT, metaphor movements, or PCW, and I have a patient in front of me. What do I do? A coaching approach or a IEMT approach? So how can I take this decision?
That's a very tough question because that's very dependent on the context that the person in front of you is facing. And any form of change work, I'm going to remove that because it's glaring with the light. Any form of work that we do with people is always related to what they're going through, what they're experiencing, what is challenging for them. So all of these modalities, and I think one of the challenges for a lot of coaches, therapists, change workers, for going and course hunting from one course to another to find the ultimate solution, is that they expect that the solution will fix the client rather than using the proper language that fits or matches the client's experience. And I think one of the models that have explained on what the client is wanting and how we can match that to a proper approach to help them out is the model of clean language that was created by James Lowley and Penny Tompkins, specifically in their problem remedy outcome model.
All right. Because one of the things, for example, that it happened to me when I did the coaching before training with IEMT and metaphor of movement, basically what I was trying to do is the client came into with an experience. I want to fit the experience of the client in my model of coaching so I can work with them. Does it make sense? And in the way that we are starting to work with IEMT and metaphor movement is totally different. I'm not going to make the experience of the patient matching my model. I'm going to adapt my work to the experience of the patient.
Mm-hmm.
So that will be. And how is this model of clean language? That is the problem, remedy, and outcome?
Yes, PRO model. So basically, we start by asking the person, what do you want? So I'm going to go with you. So Rafa, choose something what do you want in your professional life? What do you want?
I want to implement a process in my team that is going to be a difficult one because there is a lot of
whatever.
people.
So okay, I want to implement something that's basically follows the structure of an outcome.
Yes.
There's something that I want to get, there's something I want to get to, and there's something that I want to achieve.
Yeah.
Basically, sometimes clients come to a professional and they are asked, what do you want? And they say, I am depressed. Or they say, I don't want to be feeling this anymore.
Yeah.
Or I want to be feeling this less. So if somebody says, what do you want? And the client replies, I am depressed. Did they really answer the question?
Yeah.
They didn't.
They didn't. No.
So you ask them, what do you want? Outcome. They told you about, I am depressed, which is the problem.
Yep.
And that basically sets the frame for what happens next. So if from the first question the individual asks, the client doesn't answer and chooses their own answer and goes their own way, they're not going to be following or complying to anything that you say till the end of the sessions that you work together.
Yeah.
So first thing is identifying, is it a problem frame? Is it an outcome frame? Or is it a remedy frame? What's the problem? I am depressed. That's in the problem frame because this is a specific problem.
Yeah.
What's the problem? I hate my job. That's a problem. Okay.
Yeah.
What's the problem? I want to be able to manage my job more effectively. That's more of a remedy.
Yeah.
That's not a full outcome, that's kind of a remedy because it's more effectively, there's a comparative over there. I want to be less stressed at work. That could be a remedy.
And for
Just
example,
let's pause for a second so the beeping stops. We'll
all right,
continue.
I cannot hear any beeping, but yes.
Okay, go ahead.
All right. So basically, if I ask to the client what's the problem, and they told me, for example, I want to be the world champion in boxing, is when I have to realize that this is what
It's
is
an
an
outcome.
outcome. It's an outcome. What the person wants. They want an outcome. So
Yes.
and there is also a very important part about what you are saying is about the first question that you do. One thing is what do you want, another thing is what's the problem. So how do you start the session? What's the problem? What do you want? Or you just choose one, and after the answer of the client you go in one direction or another?
So usually you don't see somebody for the first time without some form of information of what's going on. You might have a questionnaire, you might have a phone call that you've done with them, you might have a chat that you've done with them, somebody referred them to you, they're asking you about, well, my friend Tony came to you and he said that he had a lot of success with you, so I want to do the same. But they have a completely different thing.
Yeah.
So Tony might have had an issue related more to, I don't know, releasing anger. Eric wants to come to you and he wants to reduce anxiety. That's a completely different thing that needs to be managed in a completely different way. Now, if somebody's flexible and understand things, they can go from one thing to another by identifying, and that's never gonna be like a 100% sure thing that you're always gonna get a result with clients when you work with them. But the idea is if you ask them what's the problem and they tell you, I want to become this, I'm like, okay, this is what you want. What's the problem?
Yeah. All right. Yes, this is important because basically when I'm thinking in the coaching environment with sports people, when you ask what they want, they say, oh, what's the problem? And they say like, I want to be professional, or I want to be a world champion. Basically there is something stopping them for that. This is why they are coming to the session. So basically, pardon?
Metaphorically, definitely, yes.
Yes. So this is what when I work with that, like when I say, all right, this is what you want, but what's the problem? So we can start to work with what is stopping them to go to become world champion or become a professional. And it's when you have all the work in there.
Yeah, so simply if you ask somebody an outcome-oriented question and they give you a problem, you know here that you either need to shift. Okay, so what do you want? I feel worthless. Okay, that's a problem response to the outcome-oriented question. So here, I need to make sure they answer my question. Okay, so that's the problem. What do you want? I want to feel less worthless. Remedy.
Yeah.
So in that sense, we are going to identify what remedy framed outcome, what remedy framed process I can use that can move them from the first position, which is the total problem, to being less of a problem. So they want to adapt. So here they need adapting skills, they need learning skills, they need to do something to be able to that. So I cannot manage my sick parent, for example. So they need skills, they need patience, they need maybe support and care, which leads us into three different categories, which is, does the person need support and care? Do they need change work or do they need training? And we have
another of the differentiation that you do when you work with, that you mentioned to me, that for me was very interesting. When you work with a client, what they need, because maybe they don't need a change work, but we have to do change work, but maybe they don't do this. They just need like support, or they just need some training. And this is very important to be able to say, all right, what the patient needs in this frame, if it's a problem or if it's an outcome, or there is something of remedy?
Yeah, so these two categories, the PRO and the training, change work, and support and care categories, Andrew Austin in his trainings shed a lot of light on them because he has experienced lots of things and tried many, many different things. Unlike other people who are training stuff who just want to give you the technique, Andrew trains more of the logic behind it. So where can you go? What's the model? What are the things to pay attention to? So by finding these two categories, because we talked about categories in our class session, these two categories, by identifying them, they can simplify the way of what is the next step or what is the scope that I'm going to be exploring based on what the person is mentioning.
Yeah.
So does this fall under the problem category? All right. If it's a problem, are they needing skills? Are they needing change? Or are they needing support? And then I can move in the scope of each one of them. Although this is done more in an intuitive way and it's not done in a planned way. Okay, so Rafa wants to solve his problem. Now I need to go and find out, and etc. So the easiest way to learn this and to understand this is to watch videos of session.
Yeah.
And start by dissecting of where the conversation is going. And defining, okay, so this person asked a problem-related question, this client responded a outcome-related answer, and it went on, and there was no result over there.
Yeah.
So what can be done differently? And then practicing this kind of thing.
I have an example very, very clear for me in this aspect, that is in elite sports, when a person have a defeat. They are defeated after all the effort, all the sacrifices. They lose the fight in boxing. They came down the ring. They are devastated, and people say to them, "Oh, sometimes you win, sometimes you learn." And this is like a kick in the balls for them, because in that moment it's not what they need. So it's this thing like people are trying to, and with very good intention, people very close to the athlete, trying to reframe the situation. Oh, this is not a defeated, it's a learning experience. In that moment, it's not what they need.
Yeah, but
so
they need support and care,
they
and
need
they need
support in that
support.
moment.
Yeah, that
they
must
just need.
suck. So that must suck. So just by telling the person, okay, that must have been horrible. I might not understand what you're experiencing, but I'm sure it sucks.
Yeah. And also, and it comes as well, this thing of, by trying to reframe too early, is not allowing these emotions of frustration and sadness to be there when it's natural to be there, because they have been defeating after all the efforts. Basically, frustration, sadness are typical emotions that
Identity. So some people jump to I'm a loser.
Yeah.
Today, yes, you are.
Yeah.
Because that's the truth.
Yeah. So this part of is very interesting, because people go too quickly, and we have as well about the time thing, too quickly in trying to reframe. Oh, come on, sometimes you win, sometimes you learn. And when I've been reflecting back after a couple of days with them, all right, when people say you that, what is the experience? It's like a kick in the balls. It's like, no, it's not what they need. So this is part of it. Is part to understanding that what the person needs in that moment. So it needs something that is support, or it needs a change work.
Exactly. And at the same time, what category does this fall into? And if I'm reframing this from this experience to this experience, I am forcing the change of category on the person, or I'm throwing my own categories on the person. So if like somebody says they feel they lost, they effectively, it's the world championship and they lost, they are a loser. They are the best loser, because number two is the number one loser.
Yeah.
And if you go tell them, sometimes you learn and sometimes you win. So if you want to do that, just stand far away, because they might punch you in the face and break your nose. But here, what's the use of my reframe?
Yeah.
What I would do, for example, if I want to support this person and they go, okay, so you lost. This is an opportunity gone. must hurt like hell. You will feel whatever you need to feel. Let's start in 2 days and see if we want to change something about this, do something differently, or you were just extremely unlucky today, because luck plays a role also in sports.
According with that, there is also, for example, in my strategy of working with sports people, I say for having the result of a win, there is three variables.
Sports people, world champions, to be specific.
World champions, world champions. So basically, world champions now, one that is fighting for go to the Olympics. So people who are on the top, and I say to them, look, and discussing this with Kiko Martinez, with the world champion, there is 3 factors in order to get a result. One is the 3 variables. One, the variables that you can control, like your training, your mental training, your dietitian, everything. Factors that you cannot control, like a referee has done a bad judgment, and the luck. Just a punch. You can have all the status in the world, just a punch in the wrong place, and you go down. So there is 3 factors that they are playing.
So many other factors. Like if we see right now what's happening in the NBA, for example, there's a team called the Indiana Pacers that are in the conference finals, and they got there. They have good players, but in the first team they played with, the star players got injured and they were able to move on. In the second round, they were playing a team. They reached to a certain point that the star player got injured and they were able to go there. Not belittling their efforts, but that helped, and that's luck, and that's the circumstances of life that are laying there. Yep. So now they are in the Eastern Conference Finals, and their star player got hurt. So the tables have turned.
Yeah. So to be able to understand all of these factors also are very important for the people who for the athletes. Also, when we get close to the fight, we are just focusing about winning. The only one thing that is in our mind is winning. But after the fight, we have to go back to say, all right, have we won or have we lost? If have we won or have we lost, which are all the variables that have been affected to the result? And this is the part of the things, part of the strategy. So at the beginning, we work with all the factors. The fighter is getting close, so we just focusing winning. After the fight, we have the result. Even if it's a positive outcome or a negative outcome, we have to go back to the factor, because we have won, but we have not done the work perfectly. There are some things that they have not been done in the right way. So all of these things is part that I think is very important to understand what the person needs in the moment. It's like, all right, the result has not been. It's like the outcome has been a negative one. They have been defeated, and just they came from the ring and they say, oh, I have vision myself winning. Everything was fine. What has happened here? Why I have lost? So all of this is what you have to work with that when you are. Yes. If there is now one in Spain, one in fighting sport that he's a lot of law of attraction, or like McGregor in the UFC, law of attraction. And when I saw it, I said, oh, good luck with that, because this is the thing. It's like you have to be sensible about what the person needs and how do you work with them, because if not, it's creating a lot of more issues, like getting the fit. Oh, reframing. Oh, it's not a fit. It's a learning experience. Oh. Good luck.
Yeah, definitely. Well, I guess this is the second episode of the Anatomy of Changework. So thanks, Rafa, for this discussion, and I look forward to a future chat.
Yeah, thank you. Bye.